meeting of N-SPRITE, which is Nimhans Suicide Prevention, Research, Implementation and Training Engagement. So this is something that I think is a wonderful initiative taken up by Nimhans. It is a premier institute and it has got very intelligent and brilliant people working, and it's got a history and track record of handling mental health issues and issues concerning the aspects of neurology and so on and so forth. So for them to come out with this, I really welcome it. As a health minister of Karnataka, I think it's a wonderful thing that you're doing. And we all know, I think the awareness levels regarding mental health and depression, and ultimately those things leading to very calamitous results in terms of either their work suffering and their career suffering, and in extreme cases, just like what we heard now from from a father who has suffered the loss of life, ultimately taking your own life. And so this is something that I think as a society we need to work at and see what all we can do to prevent from someone taking their own life. How we can prevent, what are the steps that we need to take, and what are the things that we need to do. I think these needs to be put in a proper perspective and tackled from various angles. There is of course the government. The government is there to one is make the right policies and promote greater awareness, especially in terms of education and in the way we deal with our own workforce and the way we deal with the people. So I think educating and awareness, these two becomes, I think, the most important aspects of preventing suicide. I think how we can make people think about this and make people aware that what are the causes, what are the instances or the triggers that lead to suicides, and how can we identify them early? What are the early signs? How do we know? So many times we are living with with people. Just now we heard the person, his own son. He's brought him up, and I think nobody should know your own child better than the parent. But I think that doesn't hold true, because there are so many things that a person goes through, and as they grow up, especially in today's society where it's more insular and more, you're living within your own realm, that there is a huge distance that takes place. So we do not know what's happening. So how do we identify? How do we figure it out? How do we know? And what we can do to prevent it? So I think there are so many experts and people who have spoken about this. And this initiative, I think, by Nimhans is to engage with everybody, I suppose. I still don't know the full background to the whole thing. I wish I'd come earlier and listened to what everyone had to speak about this. But I think the most important thing is to get people on board. I would say that as a government, if